pandemic.
Nurses need to fight for their voices to be heard. Those are the words of the North Dakota Nurses Association president in a virtual press conference held this morning. Nakaya Carrero tells us how the association is pleading for more to be done.
A nurse with COVID-19, symptomatic or asymptomatic, is still ill and his or her body needs to recuperate, not to be working in a high-risk and potentially deadly environment.
The North Dakota Nurses Association held a press conference to ask that Governor Doug Burgum pull the order that would allow asymptomatic COVID-19 nurses to continue working, and for local leaders and communities to do their part in helping drive numbers down.
Because of our failure to respond in a timely manner to the threat of COVID-19 with real evidence-based mitigation strategies at the state level, we are now desperately trying to play catch-up and find ourselves in a true crisis.
Executive Director Sherry Miller says North Dakota nurses are afraid to speak publicly about their experiences, so she shared some of those stories today.
From an ICU nurse. Honestly, I put my notice in and decided to travel. The hospital was not listening and people have died because of it. I've had patients in their 20s on the ventilator who ended up dying from COVID after spending weeks in the hospital. Myself and my colleagues, whether house staff or crisis travelers, are tired and hurt. I arrive to my shift on the COVID ICU and feel instant anxiety. I feel like I'm in a war zone. I see chaos and stress all around me because someone just coded or died.
President Tessa Johnson says nurses have expressed a lack of support by hospital administration and local leaders as hospitals fill up.
They feel like they've been hung out to dry, essentially, with little support. And then when the order came that they can continue to work while positive was really the last straw for them.
Johnson says they want Governor Burgum to meet either with the Nurses Association or nurses on the front line. Reporting for KX News in Bismarck, I'm Nakaya Carrero.
And Johnson also said, according to the American Nurses Association, 200,000 nurses across the country have already reported symptoms of PTSD because of COVID. For the latest information on the coronavirus, including resources, all of the latest case numbers and prevention, head to kxnet.com.
In continuing coverage tonight, who will take